What do you call this part?
The cortex.
This part is called a...
Medulla.
This is called a...
Pyramid.
And the pyramids drain into a...
Minor calyx.
A minor calyx.
Is that the fatty area?
So, the fat. This is all fat. Now what I want to do is... Do you see how I can get in here?
Yeah.
Okay. What we're doing right here, pardon the light, tear it, is this is part of the drainage system.
Cool.
And they have injected it backwards. So if I tear this, well, that's what their intent is. If I tear this off, you can see where we now have something draining right here. There's a renal pyramid draining into the minor calyx. As we track this down, you should be able to see this heading out to
The ureter.
the pelvis into the ureter.
And also through the major calyx.
So, somewhere along here is part of a, this is part of the pelvis. Where would you call it a major calyx? I don't know. On this one. You can see the interlobular arteries and veins. You can see a very nice papilla coming down here, draining into its minor calyx back here. It's going to head out.
Ours is a lot worse.
But they took the capsule off. Darn it. Well, no, as a matter of fact, see, I kind of like yours because you can see how this minor calyx would have been right here, where this papilla ends up right here, would have been the minor calyx. This is then draining into the hilus, which goes to the ureter.
So I'm confused when it comes to medulla and the pyramid. Is the pyramid?
A pyramid is part of the medulla. What's the other part?
The cortex.
No, the other part of the medulla. The pyramids are in here as the
Minor calyx.
renal
Renal
columns. And you can see, see they have a collecting duct ending all the way up here. That's what I hate about the sheep kidneys, because they've got them all the way up in here. They're like there's a little tiny one here. Can't see a renal column in here very well. This looks like a renal column. Here's a piece of a renal column.
Wouldn't like
So you don't have the beautiful straight lines that you see in a pyramid.
Renal columns are what separate the pyramid?
They are cortical tissue in between pyramids. They
Like
extend everywhere.
lesions?
It would be right in here would be one. You can see all the straight lines in here. This is all the collecting ducts setting down here. This would be the area of a renal column. See them much better on the model.
What would be the hilum?
This whole area is filled with fat in the pelvis.
Cool. So neither of our kidneys have capsules.
No, this